Several times a year I'll have people come in who say they have had a sudden hearing loss. Generally speaking, it may have been associated with a cold or the flu, or sometimes it's not even associated with anything they can think of. So they go to their primary care doctors. The doctors look in there and they don't see anything, and so they suspect that it might be a bacterial infection, so they give them an antibiotic, and they take the antibiotic for 10 days, and the hearing doesn't improve, and they go back, and when they looked at them the first time, they didn't find any wax. If there's no wax in the ear canal, and the hearing is really bad in that ear, this is something that has happened to the nerves, the cochlea, or the nerves inside the cochlea. If a person waits a period of time without having other things to reduce the inflammation that's happening inside the cochlea, then the hearing loss can become permanent. When we see a patient, usually it's after 2 weeks or so, the antibiotic didn't work, the other medication didn't work, and so they come to us. We send them for an audiogram, and they shows that they have a large hearing loss in that ear. Generally, when we have a person who has a sudden hearing loss, we have a 2-week period of time to treat with a steroid, a high dose beginning decreasing dose of steroids to reduce the inflammation in the cochlea, to try to preserve as much of the hearing as we can. After a couple of weeks, we still try the steroids, but generally we don't get a good relief from that. So we're trying to catch up when the person has noticed that their hearing loss was pretty bad in the beginning, and there is no infection or inflammation in the ear that the primary care doctor can see, and no wax. Then the person should be sent to us so we can evaluate what's going on. And as I said, if we get it within 2 weeks, the doses of steroids can be justified to help to reduce the inflammatory process in the inner ear. I usually ask the person the question, if you went blind in one eye, would you go to your primary care doctor? Most of them say no, they would go to an ophthalmologist. So I don't see how different that the eye is from the ear, because they're both very important senses. And if you have a sudden hearing loss, you should go to an ear doctor as soon as you can to try to get whatever medications and things or other procedures that will help to hopefully reduce the amount of hearing that results from this. The longer it takes to be seen and treated, usually with a steroid, the less chance we have of improving the hearing.